Good afternoon to everybody who is joining us virtually. My name is Grace Ho, and I am the Deputy Governor for Health and Human Services in the Office of the Governor, J.B. Pritzker. I have to my left our First Assistant Deputy Governor, Ryan.
This meeting is being recorded.
Opportunity to work with for many years now. Thank you all for joining us this afternoon for the Health and Human Services Portfolio Briefing. I'm pleased to have our entire Health and Human Services Cabinet for the state of Illinois here with us today. Some with us here in the room, some virtually, and for the first time, we're going to highlight all of our health and human service agencies and commissions, as well as our cross-agency work led by our chiefs. Thank you to all our public servant leaders for their dedication, your dedication to the public good. It's a time in history where we need to recognize the sacrifice and the commitment that public officials play in our society. They keep our state's lights on. We, the Health and Human Service agencies, are the heartbeat of Illinois, and for so many reasons that all of you watching and listening already know. I've had the privilege of working with Governor Pritzker for 6 years, first starting as the Secretary of the Illinois Department of Human Services, then becoming the Deputy Governor for Health and Human Services in October of 2023, working with this amazing group of people in our governor's office, as well as the Health and Human Services portfolio. We have achieved so much together as a team in government, as well as in partnership with our grantees, vendors, community agencies, stakeholders. This team, our team, we've done so many things together. We've helped our state come back from a deeply eroded health and human services system that we inherited in 2019. We strengthened our systems, programs, and services. We protected Illinois residents throughout the COVID pandemic, and we responded to many crises across the state. And now we are at the front line as threats come to us on the federal level. But what I know, because we have proven this, is that we are strong. Our Health and Human Service grantee partners and other stakeholders have helped us achieve the missions of our agencies and help make Illinois a great place to live, to learn, raise a family, and work. I want to quickly recognize our immediate team in the Health and Human Services portfolio in our governor's office, Ryan, Angela, Mitchell, Isabel, Edward, and Andy. They help keep us honest and making progress. We have a lot to cover. I hope that you will find that what we have done to meet the moment, to find efficiencies, to maintain services where possible, and I know that not everyone will agree with the decisions that we made, and they were hard decisions that we had to make. This is the start of the budget process, and I want everyone to know that we toiled away in many, many hours to put the best foot forward. As many of you have tuned in to the governor's budget and State of the State address, his budget for fiscal year 2026 builds on 6 years of historical fiscal progress, maintains the commitment to fiscal responsibility while growing Illinois into an economic powerhouse. The budget continues transformative investments in early childhood education and childcare, K through 12 education, in our Smart Start program at the Illinois Department of Human Services, as well as our newly created Department of Early Childhood, continues record levels of K through 12 funding, builds on previous higher education investments, and provides record funding for human services and Illinois' social safety network again and again and again and again. Ensures healthcare and food access to raise families out of poverty, and further invests in Illinois' economic infrastructure to support private sector job creation and make Illinois more competitive on the national stage. Here's a snapshot of the total fiscal year proposed operating budget. As you can see, the state of Illinois' entire budget with all funds is $130 billion. On the right is our general funds picture, which is $54 billion. If you could see the green slice as well as the teal slice, Healthcare comprises 17.3% of our general funds obligation, and human services comprises 22.2% of general funds. Our fiscal year 26 health and human services investments all in is $66.4 billion, which is almost a 10% increase from fiscal year 25. We are going to review in more detail the total budget, the budget outline for our six largest agencies, which include DHS, HFS, DPH, DCFS, Aging and Veterans, and their combined budget totals $65.6 billion, which is a almost 10% increase from fiscal year. With that, I'm pleased to turn it over to my partner, longstanding partner at this point, our first Assistant Deputy Governor for Health and Human Services, Brian Crook.
Thank you, Deputy Governor Grace. I want to double down on Grace's commendation of the cabinet leaders who are here today. You will not find a more devoted, creative, smart, flexible, and caring group of leaders anywhere in government. And I think that's a credit to both Grace and Governor Pritzker. Naturally, there is great concern about the federal funding picture going into a new fiscal year. We wanted to highlight that the fiscal year 26 state budget is reliant on nearly 10% of federal funds as part of that larger budget picture that Grace presented. This is critical for massive programs ranging from Medicaid to supplemental nutritional assistance program, formerly known as food stamps, childcare services, and more. We are carefully and every single day monitoring potential impacts from changes at the federal level to the programs that we all care very deeply about. The priorities of the governor are reflected in the budgets of every agency. Naturally, we are continuing to prioritize aggressively maintaining the social services ecosystem, keeping communities safe and healthy, investing in early childhood infrastructure of the state through an unprecedented new state agency and the work of multiple agencies to make it possible. Secretary Ramos is here, and we're very grateful for that. We want to continue to create stable homes and safe neighborhoods. Investing in the Home Illinois program remains a priority, as are the many investments in violence prevention programs statewide. Special salute to Kiwana Bell, the leader of the Violence Prevention Office at the Department of Human Services. Expanding opportunity for people with disabilities is something that we will never waver on. Veterans, likewise, older adults, and support for people to live maximally independent lives in the communities of their choosing will always be a priority to Deputy Governor Grace, to Governor Pritzker, and every leader in the cabinet. Creating a sound economy and making sure that we have a fiscally responsible approach to budgeting is an ongoing priority, as is continuing to build the workforce that fuels the protection of our children in the child welfare system. You'll hear more about that from Director Miller momentarily, and streamlining behavioral health services. We have with us Dr. Inger Burnett-Ziegler, our new Chief Behavioral Health Officer for the state, and we've made extraordinary and unprecedented investments in behavioral health, and that is an ongoing priority. We want to briefly give a shout out to every cabinet leader here. You're going to hear from every one of them. These are the leaders of the six largest agencies in the Health and Human Services portfolio. We will begin with a presentation from Secretary Dulce Quintero, who leads the Department of Human Services, and you'll hear from each of the other pictured leaders. Without further ado, I'm going to call Secretary Quintero to the front and take it away. Thank you so much for your attention and care.
Hello, it is wonderful to be with you all today. We know this work is more important than ever, and together we are carrying it out with courage and compassion. I want to thank Governor and his remarkable team, including my predecessor, friend, and mentor, Deputy Governor Grace Ho. Thank you to my leadership team at IDHS, Tiffany Blair, John Schomburg, Ryan Thomas, and to our division and office leaders as well. And big thanks to our IDHS budget leads, Joe Wellbaum and Adam Mauro. Their steadfast dedication makes this work possible. Here at IDHS, we assist Illinois residents along the continuum of care, from assistance from pregnant people and funeral benefits and everything in between. IDHS services touch 1 in 3 Illinoisans at some point in their lives. Our services are holistic, from employment supports, behavioral health and recovery, access to nutritious food, and much more. Here you can see some of our accomplishments over the past year, including a huge and historic win. The Dignity and Pay Act was signed into law. Many in this room helped design and advocate for this legislation, ensuring that people with disabilities are compensated fairly for their skills. Our SNAP application determination timeliness was ranked 4th in the nation. We are distributing records levels of life-saving overdose prevention medications, with the statewide overdose report showing an 8.3 decrease of overdose deaths from 2022 to 2023. Now to our overall proposed budget, right around $13.9 billion. Our proposed budget includes over $180 million to support compliance with OLCID programs and consent decrees. This includes $51.2 million in new investments for LIGA's consent decrees so that more individuals waiting for services have access. This also includes funding for a 50-cent per hour rate increase for direct support professionals. Investments will also allow individuals with disabilities to remain in their own homes rather than institutional care through our home services program. A home-based services program increase of 5% would allow individual access to more community integration activities. These investments strengthened our commitment to community support so individuals with disabilities can lead full, healthy lives. Home Illinois has a proposed investment of $282.7 million. $91.5 million of this proposed investment will support the One System initiative. This investment reflects the state's commitment to long-term and equitable solutions for all people experiencing homelessness. The governor's budget proposal continues Smart Start Illinois. This includes $90 million to maintain Smart Start workforce grants. These grants are already proving successful in retaining staff and allowing early childhood providers to earn a living wage. The budget supports $10 million investment for rate enhancement for early intervention services, improving access to care. As part of our commitment to mental health, the governor's budget assumes a passage of permanent funding stream for 988 services. The $37 million will replace previous federal funds. We hear stories all the time from operators from the 988 Lifeline about the fulfillment their role brings to their lives. Like Mackenzie, a 988 Lifeline operator who shares the importance of being present, offering empathy, and walking alongside someone until you feel safe again. McKinsey is just one example of how 988 operators go the distance in providing real human-centered help. So back to the overall IDHS budget. The FY26 general revenue budget has a 5.2 increase over the fiscal year 25 projected spending. There's an 8.5 reduction in our federal funds budget. However, the proposed budget is sufficient to allow us to fully expand federal funds that are available. You can see the breakdown here. Now getting into the divisions of IDHS. First, the governor recently announced the plans to integrate the Division of Mental Health and the Division of Substance Use Prevention and Recovery. The integrated Division of Behavioral Health and Recovery will improve and access and streamline care for those with complex needs. The integration planned to launch in July will reduce administrative burdens for providers. The FY26 request will remain separate appropriations for both mental health and substance use. I want to share another story with you that highlights the important role our community providers play across Illinois. John, picture here, was previously experiencing homelessness, living in his car in Chicago and misusing opioids. John was arrested in early 2024 and was referred to the Narcotics Arrest Diversion Program at Thresholds instead of facing immediate charges. This allowed him to focus on recovery. John is now a dedicated member of the treatment community, using his story to support others in their own recovery journeys. IDHS providers play a pivotal role in supporting people like John, and we value their ongoing partnership. Up next, the Division of Developmental Disabilities. The proposed budget includes $31.2 million for new adult PUNS placements. There is an investment of $27.2 million for home-based programs. Additionally, the division analyzed inefficiencies and estimates $10 million in reduced overtime costs. The Division of Early Childhood reflects $175 million of the new GRF investments for childcare. This funding will be used to continue the governor's Smart Start initiative, supporting holistic growth across the childcare assistance program. This budget also supports a $10 million enhancement of early intervention provider rates. Up next is the Division of Family and Community Services. The proposed budget includes $25 million in GRF for the Reimagined Public Safety Program to maintain the current program expenditures levels. We also see a $9.5 million to support an increase to the TANF and AABD due to caseload growth and consumer price index increases. There's also funds to annualize domestic violence hotline, the programming, and additional investments for funeral and burial program based on need. And last but not least is the Division of Rehabilitation Services. The division secured a $12 million in federal realignment funds for the vocational rehabilitation program. This requires $6 million in additional state matching funds to support the new federal funds. $105 million of this new investment is needed for the home-based services program to address anticipated caseload growth and collective bargaining costs. And with that, thank you all for your support as we continue to uplift all Illinoisans. Next up, it's my honor to introduce my colleague, HFS Director Lizzie Whitehorn.
Good afternoon, everyone. I am HFS Director Lizzie Whitehorn, and I am pleased to join you to share details from HFS's introduced FY26 budget, as well as some highlights and accomplishments from this past year. HFS administers the Illinois Medicaid program and child support services. The department serves more than 1 in 4 Illinois residents and nearly half of children in the state. Medicaid provides health care coverage to more Illinoisans than any other insurer. Before I jump into sharing our FY25 accomplishments, I have to say a huge thank you to the staff at HFS. None of these accomplishments could have happened without their hard work and dedication to the customers we serve. I especially want to call out our Chief of Staff, Dana Kelly, and senior team members Kelly Cunningham, Kate Yeager, Brian Tribble, Laura Phelan, and our incomparable CFO, Mike Casey. I also have to thank the Deputy Governor team, especially Grace and Ryan. Throughout this budget process, throughout all the work that we do, we have to make really hard decisions. And it is only made easier by having them there to support us along the way. So now to the accomplishments. We were really excited to launch the statewide medical debt relief program last year. So far, the program has relieved over $125 million in medical debt for over 100,000 Illinois residents, with more to come in this fiscal year and FY26. Illinois was a national leader in keeping Medicaid enrollees covered during the unwinding period from the continuous Medicaid coverage requirement that was in place during the pandemic. When we finished unwinding last spring and all of our customers had again been through their annual redeterminations, 78% of Illinois customers retained their coverage, which led the Midwest. Last year, HFS also led the Advisory Council on Financing and Access to Sickle Cell Disease High-Cost Drugs and Treatment, established by the governor's executive order, bringing together national experts and practitioners. The council made a series of recommendations for developing financing solutions and increasing access to new high-cost drugs and therapies for Medicaid customers. We delivered a report detailing these recommendations to the governor and the General Assembly in December and are now looking at how we will implement the Advisory Council's recommendations. We've also expanded maternal health coverage to include 2 new provider types, perinatal doulas and lactation consultants. And last month, we were very pleased to be chosen to participate in the federal Transforming Maternal Health Model, which will bring technical assistance and, more importantly, $17 million in federal dollars over the next 10 years to develop an integrated approach to care during the critical pregnancy, childbirth, and postpartum periods. In our Division of Child Support Services, we implemented a new policy in July to pass through all child support collected on behalf of low-income families who are current or former temporary assistance for needy families recipients to the receiving parent. With this change, Illinois became the first state to unconditionally pass through all child support paid to the receiving parent. Our accomplishments. We were thrilled to receive federal approval for the 1115 healthcare demonstration waiver, which allows us to expand Medicaid coverage to address health-related social needs, as well as violence prevention and pre-release services for individuals leaving carceral settings. By addressing the root causes of disparities, such as housing and food insecurity, and a lack of consistent access to transportation, we will be able to help improve health outcomes. We continue to work with our partners at the Department of Insurance to plan for the launch of Illinois' state-based marketplace. Together, we have awarded grants to 5 organizations that serve as Get Covered Illinois healthcare navigators and have worked to procure vendors for IT and call center needs ahead of the fall 2025 open enrollment period. We were also selected to participate in the new federal Certified Community Behavioral Health Center demonstration model, which expands access to integrated behavioral and physical healthcare services and will allow us to invest $150 million into the behavioral health system. Finally, we implemented rate and reimbursement increases that resulted in more than $600 million in additional payments for Illinois hospitals. So now I'm going to turn to a story from our medical debt relief program, which you also heard a little bit about earlier today from Governor Pritzker. These beneficiaries are allowing us to share their names and stories. And so I wanted to highlight the story about Christine. She had multiple miscarriages and a stillborn baby, and then gave birth to a baby who weighed only 2 pounds, 13 ounces. Christine's daughter was rushed to the NICU, where she remained for the next 99 days. The significant cost of the lengthy stay in the NICU resulted in medical debt for the family. They were found to be eligible for debt abolishment through our medical debt relief program and had a total of $2,587 in medical debt relieved. Most importantly, Christine's daughter is now a healthy 6-year-old. This is just one story from a round of medical debt abolishment that relieved debt for more than 52,000 Illinois residents. So I'm going to turn to our Medicaid program now, and this slide shows our Medicaid enrollment. As you know, the majority of our budget supports the state's Medicaid program. So this slide shows a breakdown of enrollees by different populations, including some of our most vulnerable residents. We're projecting a total of nearly 3.5 million enrollees for FY26, which is up from almost 3.4 million projected for FY25. One of the categories that I want to point out here is the Affordable Care Act expansion population. This population includes single, childless, non-disabled adults under the age of 65 who previously would not have been able to enroll in Medicaid prior to the ACA expansion. We are projecting about 785,000 ACA adults for FY26. Right now, Illinois receives $7.4 billion in federal funds to cover this population. If the ACA Medicaid expansion is cut at the federal level, we will lose that federal funding, and all of the adults in that population will lose their health care coverage. I'm going to turn to child support services for a moment before we go back into some highlights of our FY26 budget. This is a recent success story about the Tanaka children. Rob, an IT consultant, moved out of state and abandoned his child support obligations. An HFS staff member was able to determine that Rob was in Wisconsin and attempting to sell a house. Child support services secured a lien on the home he was trying to sell. He was unable to sell the home with the lien and ultimately paid the $75,000 in child support that he owed his young children. So turning to our FY26 proposed budget highlights, our proposed budget takes into account a growth in liability for the medical programs. Not unlike other areas, there's a growth in healthcare costs across the country. In our case, this is driven by several factors, including that the enrollees who remain covered after the unwinding have a higher acuity than previous enrollees, double-digit increase in pharmacy costs, the annualization of FY25 legislative additions, and enrollment and service utilization increases. We also continue to prioritize investments to strengthen behavioral health access. We plan to invest $27.7 million into beginning to stand up psychiatric residential treatment facilities in Illinois to comply with the NB consent decree. Almost $192 million in CCBHCs, which includes welcoming additional CCBHCs that qualify, and roughly $133 million to continue our work with the Pathways to Success program, which serves children with complex behavioral health needs. Our budget on the child support side includes funding that allows for the full pass-through rule we implemented in July to continue into FY26 so that families who currently or previously received TANF benefits, the receiving parent will continue to receive 100% of pass-through child support payments. Our other healthcare investments include a proposed $12 million to continue implementing PACE, which assists eligible seniors to be able to live independently in their communities, $27.5 million for a fully integrated dual eligible special needs plan, which replaces the MMAI demonstration program for customers duly eligible for Medicare and Medicaid, and $4 million towards building out the infrastructure to support our healthcare transformation 1115 waiver work. Finally, our FY26 budget includes a general funds investment of $110 million to maintain the health benefits for immigrant seniors program. Introduced budget assumes the sunset of the health benefits for immigrant adults program. This plan ensures sustainability with fewer resources while maintaining care for the highest risk group. HBIA consumers will remain eligible for federally matchable emergency services coverage. And our last story of a customer to highlight is about June. 7-year-old June has experienced physical abuse and struggles with behavioral health disorders. She has gone through a number of foster placements and psychiatric hospitalizations. June was about to be sent to a residential facility for treatment, but her youth care caseworker believed that a specialized foster family could offer her the best chance for a stable future and a better life. In collaboration with DCFS, June moved into her new home with her foster family. 7 months later, June's foster mom reported that June was developing a healthy attachment to the family and was showing improvements to her psychosocial functioning. Just quickly go through, this slide shows our FY26 proposed all funds budget. And I would just note that in general, 60% of our budget is funded through federal dollars. And then this next slide shows our general funds budget breakdown. Finally, I won't read through all these, but we have a packed agenda of goals for FY26, including that we continue to ensure that all Illinoisans have access to high-quality healthcare services. We will continue to work to implement the recommendations from the Advisory Council on Financing and Access to Sickle Cell Treatment and other high-cost drugs. We continue to move forward on our maternal health work, and we will also continue to hold managed care organizations accountable for delivering high-quality care to our customers. We will, of course, continue to implement the medical debt relief program and look forward to relieving more debt across the state. We're excited to be building the infrastructure to lay the groundwork for success with our 1115 waiver, and we will continue to work to expand integrated behavioral health services. Finally, we will continue to ensure that families who rely on child support services receive high quality and timely support. With that, I'm very happy to introduce my colleague, DCFS Director Heidi Miller.
Hello, and nice to see everyone here. Nice to see everyone watching from your screen somewhere in the state of Illinois or maybe somewhere else. My name's Heidi Miller, and I'm the Director of DCFS. And I want to start out by thanking Governor Pritzker and Lieutenant Governor Stratton for their unwavering commitment and love for the state that shows through in everything that they do. I want to thank Deputy Governor Ho and Assistant Deputy Governor Croak for creating an environment in this portfolio that allows us to all show up as our best selves every day. And I want to give a special shout out to my Chief of Staff, Jackie Dorch, and the leadership team at DCFS, Andy Munamoto, Tim Snowden, Tierney Stutz, Julie Barbosa, and Brian Doherty. And of course, special shout out to our hardworking fiscal team, our fearless leader, CFO, Kirsten Neswick, and Brian Turner, who spent countless hours working on our budget this year, and the entire fiscal team. To the fiscal team who I know is watching right now, I have one thing to say, maha. At DCFS, one of the things that we've worked very hard on over the past year is really trying to center ourselves around a vision and a mission, sort of core priorities and values that our entire agency has participated in setting forward. Our vision, the bedrock of our work at DCFS, is a vision where every child and youth can grow and thrive in a family in all of the different ways that families look across the state. The core pillars of our work at DCFS, and we like to think of what we're doing as building a house. The vision is the bedrock, and the pillars that hold up the house are really our strategic goals. Right-sizing, empowering and equipping our staff for success, supporting children and youth with medical and behavioral health care needs, and ensuring our children and youth transition out of care successfully. But the center pillar that is really holding up the house of DCFS is centering our policies, practices, and procedures on what is best for children, youth, and families. We're engaged in the hard work of ensuring that what we do is centered on the people we serve. I'm going to sort of start out with a story that illustrates some of our core values and vision in action. The story of resilience, Douglas's journey from heartbreak to hope. In November of 2022, Douglas, who was 18 at the time, faced an unimaginable loss. His mother passed away from terminal breast cancer. His father wasn't involved in his life consistently. He didn't have any known family in the Chicago area where he was living. And so he arrived at the Garden of Prayer Youth Center as an emergency placement while he was awaiting a foster home. This environment for him turned out to be a turning point. He found a sense of belonging there. He found a sense of connection with friends, with peers. He enjoyed his time so much that he expressed a desire to remain in the group setting. I think also recognizing the benefit he was receiving, which is a real sign of maturity and the resilience of this young man. During this time, he really made a remarkable transformation. And he formed such significant and positive attachment with the staff that he was able to experience a really life-changing event in that the staff member decided to become his foster parent. So in November of 2023. So today, Douglas is thriving with his foster family. He is living out DCFS's vision of growing and thriving in a family. He's making friends, he's forming relationships, and he's excelling in school. This story highlights one of our biggest accomplishments in FY25, that FY24 and 25 that I want to point out here, and that is in 2024, more youth in DCFS care found permanent homes than in any year in the last decade. And we have more improvements to make, but in 2024, DCFS increased guardianship permanencies by 42%. We exceeded our consent decree targets. At the same time, we increased adoptions and increased reunifications as well. A few other accomplishments that I want to highlight. DCFS continues to hire frontline staff. And in 2024, we achieved a record number of staff, 3,840. That's the highest number in more than 15 years. It's a 30% increase from June of 2020 to December of 2020. And that increased staffing had a real benefit to the youth and families that we serve. It reduced investigator caseloads. And it allowed DCFS to exceed federal performance standards in 2024 by seeing 97% of all our youth in less than 7 days. We also migrated our hotline to Illinois Connect, which is the new system that will transform technology at DCFS. And we launched the SAFE model in Illinois Connect on August 11th. Since that launch, the hotline or SCR has reduced the percentage of cases screened in for investigation from 42% to 37%. And if you remember, one of our core pillars from the beginning of this discussion was right-sizing the agency. This work is helping us to achieve that goal. At the same time, our hotline calls continue to be answered in real time, and callers are connected to a call floor worker 15 seconds on average. We've also improved placement options for youth through using capital investments, adding 80 specialty residential treatment openings and preserving 76 existing openings for youth, which helped us reduce the number of times youth remained in psychiatric hospitals beyond medical necessity by 28% in FY24 as compared to FY20. We've also added emergency resource homes with special thanks to Chief of Staff Jackie Dortch for leading the charge, which helps us eliminate the need for youth to sleep in DCFS offices. And we've been able to dramatically decrease the instances of office stays throughout the state and the length of time kids have to stay in office. And as I mentioned, Illinois Connect is transforming child welfare services in Illinois through developing a user-friendly system that incorporates automations with strong data security. We received recognition in 2024 for a software program that automates and streamlines the assessment and approval of consent requests for psychotropic medications within our DCFS Guardian's office. That innovation saved 5,000 hours of manual processing time and was awarded the ISM Award of Excellence for Best Use of Technology Internal Focus from the American Human Services Association. Quick highlights from our budget. Our total proposed budget is 2.4. That's an increase of 4.75% over FY25. That is accounted for by workforce investments. DCFS is proposing to increase our staff by another 100 positions to fill critical vacancies. And we are increasing salaries for our private partners to ensure that they can continue to do high quality work. We're also adding additional $29.5 million for serving youth in high acuity residential settings to ensure that they can be stable and successful, and increasing our support for home and community-based services so that as many youth as possible can remain home and receive the care they need. This is an overview of our budget. You can see our appropriation proposed, the change from FY25, and the percentage of GRF versus federal fund. One more story. Miss Faith. When you meet Miss Faith, the first thing you notice is her smile. She's a mother of 3, and her children were brought into care in 2020. The reason she's smiling is she was able to reunify with her children. And working closely with SOS Illinois, she received the services she needed to be a better, more present parent. This is the ultimate success story for DCFS. This is the ultimate achievement of our goals, helping support a family so that that family can care for their own children safely. I'm going to skip through these slides, which are just a visual depiction of our data, other than to see that, again, we're seeing success with the rollout of our SAFE model in the number of investigations. We've seen an upward trajectory over the last 5 years, and we're finally starting to see some right side. And finally, wrap up, our goals for FY26 are really driven by those 5 pillars that I mentioned. Want to right-size the agency by investing in and collaborating on strategies to support families and avoid child welfare system involvement. And that includes supporting community pathways for families and completing the next phase of our SAFE model. We want to center children and families in everything we do, and that includes increasing support for relative caregivers. Special thanks to the KIND Act, Governor for signing that into law. We want to expand intact family support and invest in community-based wraparound services for young people and families so they can remain safe. We want to equip and empower our staff by hiring and filling critical positions, updating outdated technology through Illinois Connect, and improving internal processes. We want to make sure that we're well caring for youth with complex needs by investing in home and community-based services and continuing to increase small specialized residential treatment homes and reducing the number of youth who are in hospitals beyond medical necessity. And finally, we want to give our youth transitioning out of care what we are obligated to give them, what we owe them, by enhancing independence planning and increasing transitional support programs for our older adolescents in care. And with that, I am going to turn it over to my colleague, Mary Kulo, the Acting Director of the Illinois Department.
Thank you, Director Mueller. And I'm Mary Killo, and I'm Acting Director for the Illinois Department on Aging. Before I advance my slides, I first want to acknowledge, like my colleagues, great administration that I have the opportunity to be a part of, not only from Governor Pritzker, but through the whole Health and Human Service portfolio, Deputy Governor Grace Ho, and Assistant Deputy Governor Ryan Crook. What's your title, Ryan? We're very fortunate to be part of this administration and to receive the support, which is so important to be able to provide leadership in these programs. I also want to acknowledge my very hardworking staff at the Department on Aging. We're a small and mighty group. They work extremely hard to provide services for adults here in Illinois. And I also have to acknowledge the whole aging network, providers and stakeholders that work every day to provide great services to those individuals. I first have to acknowledge the mission of the Department on Aging. And many of you may know this, but it's to serve and advocate for older Illinoisans and their caregivers by administering quality and culturally appropriate programs that promote partnerships and encourage independence, dignity, and quality of life. This slide shows some of our metrics and accomplishments for the current fiscal year. Our largest program, the Community Care Program, serves about 78,000 older adults annually. And CCP agencies provide about 3.8 million hours of service per month. This is significant because every month an older adult is on CCP and out of a nursing facility, it saves the state about $3,600 per month. Other key metrics for our program include over 11 million meals, home delivered meals being served to older adults, and over 1.8 million meals in congregate settings. Our senior helpline has responded to over 151,000 calls, connecting older adults and families to needed resources. Last but never least, our adult protective services responded to over 23,000 cases. One of our proudest accomplishments for this year has been the issuance of an executive order to begin the development process for a multi-sector plan on aging, or MPA. That MPA, under the leadership of Governor Pritzker, allows Illinois to join 15 other states that are actively preparing or have recently implemented an MPA to serve as a 10-year blueprint to support healthy aging. We have already begun the development process and look forward to submitting our plan to the Governor and the General Assembly by December 31st of this year. This administration has a strong commitment to the Aging Network's workforce. Since 2019, the state has invested approximately $2.1 billion into CCP rate increases to support workforce retention. In addition, we have put forth other efforts to support direct care workforce and recruitment, such as new training curriculum, surveying, and listening sessions to improve both the recruitment and retention of this workforce. Alongside the direct care workforce, we must also acknowledge the 1.3 million unpaid family caregivers in Illinois to help older adults maintain their independence and quality of life. Although we support these programs with small resources, we continue to explore and develop additional strategies to support family caregivers, including leveraging best practices from other states and adding a new free caregiving resources to our website. This time goes by fast. I'm going to quickly tell you about Ron. Was a family caregiver. Ron and his wife cares for his wife living with Alzheimer's disease. This represents one of many family caregivers who have benefited from caregiving resources and support services. After connecting with a community service provider funded through the Department on Aging and the Local Area Agency on Aging, Ron and his wife began attending dementia-friendly outings, support groups, and other programming to improve their quality of life. Let's get to the budget highlights very quickly. The overall governor's introduced budget maintains funding levels for programs and services, with some increases for existing programs. There is a 10% increase for the community care program amounting to $140. This will accommodate the January 1st rate annualization and anticipated utilization growth of approximately 9%. Initially, there is an increase of $8 million for home delivery, which will help offset rising food and delivery costs. There is also an increase of over $2 million for adult protective services, accounting for anticipated caseload increases and quality improvement. The actual numbers, as you can see that the FY26 introduced budget is slightly over $2 billion with an 87% increase over fiscal year 25. Although you may notice changes from FY25 in funding categories, a shift from GRF funds to more on the commitment to human services funds, I just want to assure you that shift between funding sources does not equate to any programmatic cuts. Goals and objectives. I have some big goals for FY26. These include completing the 10-year MPA that I mentioned earlier, as well as a new 3-year state plan on aging. Both of these documents will aim to create comprehensive action plans to move Illinois forward in better supporting older adults and family caregivers. We also want to continue to focus on workforce recruitment and retention, along with support for unpaid family caregivers. FY26 introduced budget aligns with our missions and values, maintaining critical investments in the aging networks, its workforce, and older adults. At this time, I would like to introduce my colleague, Illinois Department of Public Health Director, Dr. Vora.
Good afternoon, everybody. My name is Samir Vora, and I have the deep honor of serving as the director of the Illinois Department of Public Health. We at the Illinois Department of Public Health are an advocate for and a partner with the people of Illinois to re-envision health policy and promote health equity, prevent and protect against disease and injury, and prepare for health emergencies. Built around 8 offices, I often speak of public health being about communities. And I am incredibly thankful every day that I have the honor of serving as the state health director here in Illinois, led by a governor, a lieutenant governor, deputy governor Grace Ho, first assistant deputy governor Ryan Croak, who believe at their core about the importance of public health and what it brings to every single community in Illinois. I'm also incredibly thankful to have nearly 1,300 public servants in the agency, including 2 in this room today, Chief of Staff Laura Vaught and our budget manager Jacob Sisko, along with our partners here at HFSRB, the Health Facilities Service Review Board, who every day work to protect your health and prepare everybody for tomorrow. From newborn screenings and cancer prevention to food safety, we here at IDPH are here for you and your health, protecting, supporting, advocating for, promoting health, safety, and well-being for every resident, community, and county throughout the state. We think about all of the ways to protect you and your communities so you don't have to. And it continues to be my great privilege to work with those dedicated public servants across our agency, doing that across the many services that we bring. One of those services is our Wellness on Wheels program, also known as WOW. And it's a great example of partnership in action. WOW aims to reduce health disparities and health inequities by providing preventive health screenings. They include screenings for things like HIV, hepatitis C, other sexually transmitted diseases. You can get blood pressure checks and other basic wellness checks in that van. We're thrilled to have been granted over $500,000 to operate a total of 8 of these WOW mobile units across the state of Illinois. We're also thrilled to be able to engage with incredible community providers such as Charity Doula Bean from the Doula Lab. The Doula Lab, found in Belleville, really is part of an initiative that the governor led last year in FY24 to fund 12 organizations around a birth equity initiative. Charity says, I want everybody to know that their birth matters, especially people of color. I'm fighting to put an end to fear-based maternal care and the maternal infant mortality rate that is continuing to rise in our Black communities. So it's been a busy year for public health, as it usually is. And one of the things that we always say, that public health remains always at the forefront, continuing to place investments into many challenges that we face and also preparing for the future. One of those challenges has been a national bird flu spreading throughout the state. And we are lucky at this point not to have had one human case here in Illinois. But our agency is working hard to prepare for any challenges that avian flu will provide. We launched a long-term care licensing and certification system to improve our data modernization. We funded 2 pilot health equity zones in McDonough and Winnebago counties. And we've expanded our firearm violence prevention efforts, ones that you heard that continue to be priorities of the governor, introducing a brand new Pause to Heal campaign and an interactive dashboard. So our FY26 budget, what you see here is just an acknowledgement of the continued efforts that the administration puts in public health. Our FY26 proposed budget is at $1.7 billion. We, similarly to other agencies in the HHS portfolio, have a big investment from federal funds. Nearly 65% of our budget is from federal funding. Those highlights include a $63 million commitment in continued investments in our communities, $26.5 million in federal public health infrastructure. We're proposing an additional investment of $15 million in a major upgrade to our data systems. We're continuing to prioritize emerging diseases, including an $8.5 million continued investment. We're adding to our healthcare regulation efforts with an additional 7.65 million in expansion of that critical program that takes care of and monitors our hospitals and our long-term care centers. And then $5 million in the continued investment on the importance of public health communication. And in order to do that, the goals here are our path forward in a healthy Illinois 2028, really prioritizing chronic disease, communicable and emerging diseases, maternal and infant health, mental health and substance use disorder, and racism as a public health crisis. Those 5 priorities in our Healthy Illinois 2028 State Health Improvement Plan are tied to these continued goals that we cherish here in public health. A unified vision for health, preparing for future emergencies, modernizing our public health workforce, including modernizing our important public health data, investing in communities and addressing health equities, and then enhancing communications and fighting disinformation. All continued goals to ensure that every county and community here in Illinois has a chance to be as healthy as possible, and working to ensure that we here at IDPH do everything in our power to make that happen. So thanks very much for your time. Next, I have the great privilege to pass it along to my colleague and friend, the incredible Director Terry Prince of IDVA.
Good afternoon, everybody. It's really exciting to be here, and thank you for that kind introduction. I'm glad to know I'm great friends with you, doing some great work together here in Illinois. As was mentioned, my name's Terry Prince. I'm a 31-year Navy veteran and proud director of the Illinois Department of Veterans Affairs. As you'll see in our first slide, this is our new logo to really draw attention to the agency and remind veterans and their families about the services that I'm going to kind of today. To give you our mission and vision. I'm not going to read the whole thing to you, of course, but it's really empowering veterans and their families to thrive in Illinois, not just live, thrive. And our vision is to make sure that Illinois is the destination of choice for veterans who are deciding where to live after their military career. We're home to nearly 600,000 veterans and countless family members. And Illinois, as you're well aware of, offers some incredible benefits for veterans and their families. We focus on 3 major areas of effort at IDVA. As you can plainly see, we focus on our people, veteran experience, and operational excellence in everything we do. And that's really centered, placing the veteran and their family at every single effort, the center of all of our work. When a veteran comes into our space, we want the wheels of productivity and effort to surround them, so they have one-stop shop, as it were. There are nearly 46,000 organizations that serve veterans in some way, shape, or form in our country. Our job is to help navigate those seas, the sea of goodwill, to ensure that they get the things that they need. Most of our work begins with our Illinois veterans homes. We have 5 veterans homes spread out across the state, serving up to nearly 1,000 residents. We have the capacity to provide low-cost, high-quality nursing home care to 1,129 residents, where an average cost of care in Illinois veterans homes is $2,000 a month. Compare with the national Genworth average for nursing home care, anywhere from $5,000 to $10,000 a month, with an incredibly dedicated staff that brought in nearly $44 million in federal funds to help reimburse the state for care that's provided in those veterans homes. You'll also see that we've invested nearly $500 million in state and federal resources to build the new veterans homes at Chicago, the new veterans home at Quincy, and provide incredible efforts and improvements at all of our state veterans homes. And as I said, and I'll repeat that number, through the support of Governor J.B. Pritzker and this administration, $500 million in construction programs just for our veterans' long-term care. That's an incredible statistic. At our veterans home in Quincy just a few weeks ago, we welcomed our first 37 residents into our 82-bed independent living facility. This independent facility, also known as a domiciliary, is going to be a major part of our ongoing program to address veteran homelessness in that continuum of care when it comes to eliminating and ensuring that veterans in Illinois have a place to live out of respect for their service and to ensure that they actually thrive in our state. In our veteran service offices, we conducted nearly 19,000 in-person and telephonic interviews. And I would tell you that our veteran service officers are a part of a growing group of people across the state that bring in $222 million a month in veteran benefits through disability and compensation. I'm not a math major, but that's $2.6 billion a year just in compensation and pension. Here's a story about a veteran who worked with IDVA for nearly 12 years trying to get their benefits from the federal VA. One of our veteran service officers literally spent years of their life working this case, and the member was awarded, as you can plainly see, life-changing money, $400,000, and received 100% disability. So is getting a $400,000 back pay and nearly $5,000 a month in a tax-free award. As you can see, there are a number of things that are going on at IDVA, and we're very, very proud of the efforts that we put in for our veterans and moving in. We got story after story of veteran success in our veterans' homes and in our community. And our budget is really a photo of the efficiencies that are happening in our veterans' homes through the incredible efforts of our Chief of Staff, Jason Strokosh, our incredible CFO, Stephanie Heckenkamp, who's here with you today. We're able to be more effective and efficient in the funds and move some of the things from the GRF using other state funds to pay for these incredible things that we do. And I think you can plainly see the effort, and hopefully you're seeing it across the state. In 2026, we're going to continue on our successes by increasing our staffing, our outreach, hiring professionals, again, to ensure veterans thrive in Illinois. Veterans, J.B. Pritzker is the son and grandson of naval officers, and you will not find a more committed governor nor a more committed state to ensure that you have the opportunity to live your best life right here in Illinois. That being said, I'd like to bring it back all the way back around to the first Assistant Deputy Governor, Ryan Croak, for his remarks. And thank you so much.
Thanks so much, Director Prince, and to all of the directors. We're going to zip through a few slides before we get to some Q&A submitted by the public. We want to take just a very fast moment to highlight the other extraordinary leaders who are a part of the HHS portfolio family and tell you about the important organizations that they lead. Director Jim Bennett leads the Department of Human Rights. You can see some of the budget and activity highlights on this slide. Tracy Fleming is the Executive Director of the Human Rights Commission. We're grateful to Tracy. Kristen Faust is the Executive Director of the Illinois Housing Development Authority, an agency of more than 350 employees doing extraordinary work across the state to provide stable and affordable housing for many, many families. Dr. Mary Milano leads the Guardianship and Advocacy Commission, doing great work to protect very vulnerable people in our state. Kim Mercer-Schleder is the director of the Illinois Council on Developmental Disabilities. She's here with Mariel, and we're very grateful to that dynamic duo for leading the charge to lift up the voices and the rights of people with developmental disabilities all across Illinois. Benro Ogunyipe leads the Illinois Deaf and Hard of Hearing Commission, a small but mighty agency that exists to support deaf and hard of hearing families across Illinois. And last but not least, John Canary leads the Health Facilities and Services Review Board, which is an important regulatory body that works closely with the Department of Public Health to approve the construction and closure at times of health facilities in Illinois. I mentioned earlier Secretary Teresa Ramos, who is an honorary member of the Health and Human Services portfolio team and also works closely with Deputy Governor Martin Torres to stand up the brand new groundbreaking Department of Early Childhood. Those are the leaders of the various agencies that are also a part of our portfolio, but we wanted to take a moment to give a heartfelt shout out to leaders of various cross-agency initiatives in the Health and Human Services team. Kiwana Bell, I mentioned earlier, leads the Firearm Violence Prevention Office at the Department of Human Services. Christine Haley leads Home Illinois and the Office to Prevent and End Homelessness. Allie Johnson is our great leader on Olmstead compliance, working with a variety of agencies, but situated with the team at the Department of Human Services. I mentioned Dr. Inger Burnett Ziegler, who is the brand new and very mighty leader of the Behavioral Health Office as Chief Behavioral Health Officer. And definitely not last but least on this list is Dr. Dana Weiner, who has done groundbreaking, extraordinary, nation-leading work in the area of children's behavioral health, connecting families in serious crisis with the services that they so desperately need. All of these women have, I have to note, have done just magnificent and courageous work every day, and we're very lucky to count them as part of the HHS family. I'm going to zip through these profiles, which I do want to mention. All of the slides will be available online for your reading enjoyment. At this moment, we're going to drive ahead to a Q&A session that will rivet you. Questions were submitted by members of the public, and we're going to call up agency directors to respond to those questions one by one. We hope that this is informative. We'll go as fast as we can, and we will post questions and answers to questions that we don't have time for today online at a later time. So stay tuned for that, but we're going to do our best to go into Q&A. We hope that you enjoy it. All right, question number 1 goes to the Department of Human Services Secretary Dulce Quintero. The question is as follows. Will the Certified Recovery Support Specialist Success Grant, which was funded by the cannabis tax, continue to be funded in fiscal year 26?
Yes. The governor's fiscal year 26 introduced budget supports continued investment for the Certified Recovery Support Specialist Program, approximately $11 million.
Sensational. Great news. Our next question is for the fearless director of the Department of Healthcare and Family Services, Lizzie Whitehorn. Director, can you explain the federal Republican proposals that seek deep cuts to Medicaid and how they would impact our beloved state of Illinois?
Ryan, this is a huge question that we could spend a lot of time talking about. And we're following the proposals closely because they could be truly devastating, like absolutely devastating to people who live in Illinois, the customers we serve, people across the country, really, but you asked me only about Illinois. So I'll just mention 2 that have gotten a lot of press coverage. One I touched on earlier, but it's the proposal to repeal the ACA Medicaid expansion. So as of the end of FY24, like our most current numbers, there's roughly 770,000 ACA adults who we cover in Illinois. That's about 22% of our current Illinois Medicaid customers. If expansion is repealed, Illinois would lose up to $7.4 billion in annual federal funding to cover this population, and the entire population would lose their Medicaid coverage. Since the expansion took effect in Illinois in 2014, we've seen really positive developments. So once it was fully in effect, the uninsured rate in Illinois dropped by 44%, which is critical to allowing people to be healthy, but also to our healthcare provider partners who don't have to absorb those costs. Studies have shown that states that expanded Medicaid under the ACA have seen broadly improved health outcomes because people who were previously not eligible for any health care coverage were able to access preventative care, treatment for chronic conditions, mental health services, and more, and no longer needed to worry about choosing between receiving care or amassing medical debt. I'll just turn to the one other proposal that's been discussed, which would be a significant structural change to how the Medicaid program has been funded at the federal level since the start. We currently get funding through the Federal Medical Assistance Percentage Structure, or FMAP, with no limit based on, the coverage that's needed. But the current proposal would put a cap that would severely limit the federal payment structure, a per member cap. And it would force states to either have to find new revenue sources to cover the difference, or to cut enrollees or cut services. So we're doing a lot of analysis right now, but it is safe to say that we would lose billions of dollars in federal funding in a very short amount of time.
The next question is for Director Miller at the Department of Children and Family Services. First time caller, longtime listener wrote in to ask, we saw that Governor Pritzker signed the KIND Act earlier this month. What is DCFS doing to implement this law? How will the KIND Act impact DCFS's budget? What impact does DCFS expect this law to have on youth in care and their families?
Whoever wrote that question is really smart. It's a great question and one I'm really excited to answer. So we all at DCFS are really excited about the KIND Act, and we actually worked really closely with the ACLU to ensure that that act made it to the governor's desk. So because of that, we really were prepared. We worked really hard from the moment that the act was first introduced to kind of get ourselves ready for implementation. So we are doing things like we have to, the act requires DCFS to promulgate rules. And so we've been prepared with our rules, kind of waiting for the governor to sign it. We also are now working actively with our partners at the Administration for Children and Families, the Federal Administration for Children and Families, to submit changes to our plan for the federal government that allows us to claim reimbursement for the families that are benefited by the KIND Act. So that goes into the next question, which is that in this fiscal year introduced proposed budget, we have proposed $7.5 million to support implementation of the KIND Act, which involves us essentially paying our relative caregivers the same rate that we pay everybody else, because we know that raising a child costs the same whether you are an auntie or whether you are a traditional foster parent who has never met the child before. However, by enacting this legislation and changing our federal plan, it allows DCFS to claim federal reimbursement for all of those caregivers. And so we project that if we are able to certify even 70% of the relative caregivers who are currently unlicensed, we will actually bring back in more than $20 million in federal reimbursement. I think the last piece was the impact that we expect this to have on our children and families. And we think that it's a relatively obvious thing that having the sort of resources and support that you need as a family to raise a child is going to significantly improve the lives of the kids and families we serve. But it's not just common sense. There's research that shows that improving the material circumstances of families is actually a proven way to reduce instances of child abuse and neglect. So that's.
Thank you, Director. The next question is for Director Mary Killo from the Department on Aging. How does the governor's introduced budget address food security for older adults?
Thank you. Thank you for the question, caller. The FY26 introduced budget provides for an additional $8 million for home delivered meals and congregate meal settings. This is add to a total of $63.3 million that the state supports for nutritional services for older adults. So it shows a strong commitment to providing that food security.
Standing. The next question is for Dr. Samir Vora, leader of the Department of Public Health. Director. Is there funding to continue the birth equity pilot grant program through the Department of Public Health?
Great question. And as we mentioned in the presentation, the important nature of investing in our pregnant persons across the state. So in the governor's proposed FY26 budget, you will see a continued investment of 24 million total in maternal and reproductive health initiatives, including this 4 million that we're talking about in terms of birth equity initiatives. As we showed in the presentation, there are incredible leaders. We were so fortunate in this past year to fund 12 community-based organizations and include certain investment of federal dollars in there. And we're very excited for the opportunity to continue this important and meaningful program in FY26 as well. Thanks so much.
Director Terry Prince, the next question is for you and the Department of Veterans Affairs. With all of the changes occurring at the federal government level, what, if any, impacts do you see on Illinois veterans and their families?
Thank you for that question. We're keeping a close eye on things that are happening at the federal government because Illinois is home to so many federal resources. We have 4 VA medical centers in this state, 20 outpatient clinics, 13 community-based outpatient clinics, and 11 vet centers. I already mentioned earlier that nearly 120,000 Illinois veterans receive disability and compensation pay to the tune of about $233 million a month. We have nearly 18,000 veterans participating in some sort of VA or state of Illinois education program. Almost 8,000 veterans with guaranteed home loans, life insurance. And here's one that really stands out that we're keeping a close eye on. There are 40,000 plus federal employees in Illinois. And the federal workforce is made up of about 30% veterans. That's a really big transition point for veterans. And we know from statistical analysis that transition from the military service is one of the key areas of suicide prevention. And so having the ability to get a federal job in a field that you've been working your whole career for is very important. Know that the federal VA has provided 2/3 of the amount of money we need to fund and build our new veterans homes and homelessness program. The federal VA has a $1.5 billion homeless program that really helps us in our efforts here in Illinois. So from where I sit and from this agency, we're paying very close attention to it. In the short term, we're seeing a couple of things, but you can rely on not just Director Prince and the IDVA, but veteran organizations across the spectrum to fight the good fight on behalf of Illinois veterans and their families. Thank you.
Another question for the Department of Human Services. Secretary Quintero. With the recent federal funding freeze and budget cuts to Medicaid and the ongoing DSP, that stands for Direct Support Professional, shortage, what is DHS's plan to make sure that programs for people with intellectual and developmental disabilities can continue to provide services that help them live in the community?
Thank you, Ryan, and thank you to the person that submitted that question. So we continue to seek historically high investments in the community-based DD system. This includes an increase to reimbursement rates for workers who support more than 10,000 people living in a community integrated living arrangements. This new rates will bring direct support professionals hourly reimbursements to $24.15 an hour in the Chicagoland area and $21 an hour statewide. So we are hopeful that these investments will continue to help providers recruit and retain more DSPs statewide. The governor's budget also includes an increase in the adult home-based services waiver, which would help about 12,000 families. Thank you, Ryan.
Thank you, Secretary. Serious and significant questions from the public. We appreciate them very much. Okay, the next question goes to Director Whitehorn, who, just for a reminder, leads the Department of Healthcare and Family Services, which runs the Medicaid program. Director, what is the status of the department's Certified Community Behavioral Health Clinic, CCBHC, demonstration since Illinois was chosen to participate last year?
Thank you, Ryan. As you mentioned, I mentioned earlier, we were selected by our federal partners to participate in June, and by October, we have now 19 CCBHCs participating in the program. They offer mental health care and substance use treatment under a new model, which is really, really exciting. The model significantly increases access to behavioral health care, including crisis care, for people who may otherwise experience challenges accessing the care that they need. The unique part of this program, one of the unique parts, is that it provides reimbursement through Medicaid for the full cost of services that CCBHCs provide, and at higher rates than community mental health centers previously received for Medicaid customers. The participating clinics must offer services that meet federal standards, and they must serve anyone seeking treatment for mental health or substance use, regardless of their age, ability to pay, or location. So as I said, we have 19 that are participating now, and they're all over the state in Chicago and the Collier counties, also Champaign, Decatur, Moline, Quincy, Belleville, and Granite City. And we look forward to opening up an application for interested mental health centers that want to become CCBHCs to join a learning collaborative, and then hopefully be able to CCBHCs. Oh,
Quick follow-up.
oh yes,
When
I
Governor
love
Pritzker took office, how many CCBHCs were there in Illinois?
Pro. No, that's not,
One?
you know what, Ryan, you're asking me a question I don't entirely know the answer to. I think there were 0, but then there were some more throughout that got.
Whether there were
But-
0 or 1, today
Yes, but
there
now
are 19.
Now there are more. Yes. and
Big
it's
growth,
ever growing.
courtesy of your
Yes.
great team. Great work. Okay. There's just 2 questions left for those who are viewing at home or in the comfort of their office, and for those in the room. So don't worry, we're going to wrap up quickly. The next question goes to the Department on Aging's great leader, Mary Killow. Director Killow, how does the governor's introduced budget support the community care program workforce?
Thank you, Ryan. As my presentation showed, that there has been a strong commitment to support the direct care workforce, or the CCP workforce. Since 2019, there had been over $2.1 billion invested in rate increases for the community care program. This introduced budget does not introduce a new rate increase, but it supports the rate increase from January 1st of this year by providing an additional $144 million to annualize the rate increase that occurred January 1st. In addition, the budget also allows the department to continue to provide and analyze the work, and continue to build a court training curriculum and certification program for the direct care workforce. We will also be conducting a rate study to analyze rate adequacy in the program.
Brilliant work to support the front lines at Aging, DCFS, DHS, and everywhere else. Okay. Last question. It's lengthy. I'm going to give you the Reader's Digest condensed version. The Early Hearing Detection and Intervention Program at the Department of Public Health serves over 120,000 newborns every year. In light of recent federal grant funding concerns, have you looked at state programs such as this one that are not covered by the state budget and have relied on federal grants for sustainability? Director Vora, Dr. Vora?
And thank you to this submitter of this question, right? An example of a really critical, important program, our early hearing detection and intervention program. And many of the ways that our federal programs impact residents all across Illinois. As we mentioned in the presentation, 65% of our FY26 budget and really throughout the years is supported by federal funding. What many of the other cabinet members have said, we are all following very closely the proposed potential actions around our federal funding. What I can say is that as we learn more from the different proposals that are out, we are doing everything in our power to ensure that we use every piece of resource that we have in the Illinois Department of Public Health to critically support and maintain these important programs that we know help all of our residents throughout the state. I think really important for all of us to understand how important that federal budget is to our state activities in the Department of Public Health and beyond, and ensure that we are doing everything we can to ensure that our important federal funding still resumes and comes to our state. Thanks so much.
Okay. I hope it's obvious to everybody who has watched that the Health and Human Services team is led by a group of extraordinarily devoted public servants who are unconditionally committed to the public interest and the common good. It's our great privilege to work with each and every one of them and to each and every one of the stakeholders who are watching. We are extremely fortunate as a portfolio to be led by a person who is not only very knowledgeable about the work of the portfolio, but who is committed to its continued improvement. And there's not a harder working, more creative, more caring leader than our Deputy Governor Grace Ho. There is just nobody who works harder or who has a bigger heart than Grace. And so I'm going to turn it back to Grace to wrap this up.
Thank you, Ryan. I think what we do requires teams within agencies, teams within offices, teams with our community organizations and grantee partners. But, you know, I want to echo what Director Vora said just for a moment. And I know that this is the beginning of the state budget season, and many of you are going to talk to your local members of the General Assembly to advocate, to affirm, or to ask for more funding for your specific lines. But I think it is important to take very seriously everything that is happening on the federal level and the very real threats to our bread and butter programming that you all care very much about. So I'm going to add to your to-do list in terms of not only do you need to continue to educate your members of the General Assembly, you also have to educate them on how our state services require this promise of federal partnership and federal funding. There's so many programs within our health and human services system that cannot exist alone with state funding. And our portfolio, I think, especially relies on that pact, this long-standing pact that we've had with the federal government that is beginning to recede and crack. And it is our responsibility to talk about the importance of how we work together and how it impacts people all across Illinois, regardless of the region. I want to thank you for being with us. It's hard to cover $66 billion in detail in under 2 hours. I hope you can see we take this work very seriously. And we also try to infuse love, laughter, and joy throughout our work. I know many of you have many more questions. There's a lot of different agencies, probably hundreds of different programs and lines and services that are within our appropriations. This is the beginning of the state budget season. There will be a lot of opportunities to ask questions and understand more. I really appreciate this team who have put their heart and soul, time with their families aside during this budget making process, working literally every day, Monday through Sunday, always available. Just like many of you who work in the community, making hard decisions, very competent, extremely compassionate team of fighters, partners. I really can't think of a better group of people to do this work with. I think many of us used to work in state government and came back to state government because we wanted to work with each other. And of course, we wanted to work under the leadership of Governor J.B. Pritzker and our Lieutenant Governor, who cares very much about health and human services. And it's not just talk. You know, we believe in government and we believe in public service, and that is so important. Government is so good and so important. I want to close by thanking my partner, Ryan Croak, who just brings so much joy and laughter literally every day to this work, and our amazing GO team. But I want to end by thanking our amazing CFOs and budget directors from the Health and Human Services team. They are the brains behind the operation, working really closely with the Governor's Office of Management and Budget, some of who graduated from GOMB, and of course our colleagues in the Governor's Office, the Budget and Economy team, who've done an amazing job in putting all of this together. I just want to say one more thing about budget. When I talk to folks who are interested in public service and want to learn about kind of my lessons or tips as it relates to really understanding government, you got to know the budget. The budget is where you see priorities in action. You understand how things tick. And so just really appreciate the creativity and the squeezing and the efficiencies and the innovation of our budget team, of course, working in very close partnership with our cabinet agencies. So with that, thank you so much for listening in. As Ryan noted, we'll have the PowerPoint posted. We'll have the questions that you all have sent in along with answers in the coming days, weeks. And thank you.